everybody. We're here with From This Corner TV, and I'm Marilyn Dayton, your host and your producer. We're having fun in this new studio. We had a grand opening. It was wonderful. The studio, there's so many lights, and this curtain behind us is brand new. It wraps all the way around, and it kind of fits the color of my skin very well. My favorite color. Well, it's gray, but it looks like blue. So anyway, that's the tour for now. Anyway, today we have a very special guest with us, and his name is Ron Agostini, and he's a physical therapist. But we say a physical therapist plus, and you will find out why in just a minute. And his company is PT of Mystic, Physical Therapy of Mystic. Ron, thank you for joining us tonight.
Thank you for having me, Marilyn.
Now, Ron and I have known each other for quite a few years now. Okay, but first, tell us what your background is.
Sure. I am a physical therapist. I graduated from Quinnipiac College back in 1987. And have been practicing since, so I do feel I'm a little bit long in the tooth and a bit dinosaur-ish.
Not really, no.
Yeah, no, but it's been one of those professions where I've been excited to go to work every morning and to help people help themselves and to know more about themselves and their bodies and to get them feeling better and functioning better.
And you and I met, let's see, maybe 10 years ago or so, when you were over on the corner of 117 and Route 1 in Groton Mystic area. Is that about right?
Yeah, I think that, about 10 years.
And
sure.
What happened, people, is this Grammy went out trick-or-treating with her grandkids. I was dressed as a mummy, and I was trying to stay out of the way of pictures on porches, and I fell. And there was this huge noise. But anyway, so I ended up going to Ron to get some help. And we kind of got to know each other, and you used physical therapy on me at that time, correct? The regular, normal
right.
Physical therapy.
Some people would say traditional, kind of more traditional.
Right. Now, things have changed since then, haven't they?
They have.
Why don't you tell us a little bit about?
For the better.
Yes, they have.
Yeah, so when I came out of PT school, I was much more aggressive with my manual therapy techniques, much more methodical. You do A, then B, then C. You try to do 10 sessions or 10 techniques within a session. So the changes that I've seen myself go through is that I start to work with people a little bit more from a human standpoint versus much more from a mechanical, protocol-oriented standpoint. So I tend to have a lighter palpation because I can feel what the body is kind of doing, so that I can kind of promote and enhance and figure out how to assist it and be more of a catalyst for change and a facilitator versus being much more of a fixer and trying to force things into a position that I might think it has to go into, whereas it might not be the case. So I have to say I've become more attentive to what the patient's needs are and have a bit more things in my bag of tricks to help people shift and change.
And I'm very grateful for that, and I'll tell you why in a minute. But when we knew each other back then, I can remember the normal physical therapy technique. There were a lot of ouches coming out of my mouth. And you were so wonderful and so patient, so helpful, but there were still ouches, okay? Today, when I go see this young man, there aren't any ouches. It's amazing, but we'll get to that again in a minute.
Mm-hmm.
So, okay, tell me some of the things that you've studied
Sure.
over the last few years.
Sure. Well, I've had the honor of working with some osteopathic physicians, so that was kind of a big philosophy shift for me. I have been working with a Dr. Tom and also a Dr. Stephen Davidson, and they have been very influential in helping me to open up and expand my view and philosophy of how to help people. So osteopathy has three premises. One is that structure and function work together. So if your structure's off, your shoulders up towards your ears, the function and your movement and your ability to do day-to-day activities gets compromised. The second is rule of the artery, which is anytime there's blood flow, nerve flow, lymphatic flow, which is the garbage collectors in the body, is compromised, then a dis-ease process then can follow. And then the third thing, which has been really kind of amazing for me to kind of watch and be present to assist, is that the body has an innate capacity to change on its own when we help to tap into our own resources that often are compromised with different types of traumas and disease processes that we see in the clinic. So that was kind of a big philosophy change. I'm also using a process called ontological kinesiology, which is a dialogue process, like talking with a person to try to understand their history, but also it's a way for me to see the sequence of events that has shaped or has kind of caused them to have this particular problem. You know, I see a lot of people with chronic neck and back problems, for example, and often they'll say, I just woke up with the pain. And those are often one of the most challenging types of problems because it usually is a number of things over a period of time that have then surfaced. So you have to really be a detective to try to help them see all of the different underlying dynamics. And that's kind of what the definition of ontology is this study of the sequence of events that shapes who we are. And it kind of is in the metaphysical world of that ontology kind of lives in. So.
Now, I've noticed that Western medicine has become more and more open to these other ideas, the more holistic, perhaps Eastern way of thinking, which is that your body knows what the problem is. Mm-hmm. Your body can tell you what is wrong, and then your body, with assistance, can heal pretty much itself once you learn the process that's needed, the process that's necessary.
Right.
Correct?
Most definitely.
For instance, my GP, she's wonderful. I was seeing her for a general checkup, and she was taking things out of her pocket, and out fell his business card. I said, oh yeah, I know him. And she says, isn't he wonderful? This was a short period of time ago. And I said, yes, he is. And that is because you have an ability, okay? And I've heard this from several of my friends that know you. We kind of know a lot of the same people. And you seem to be able to be sensitive to when someone's body's talking to you. How does that work? How do you do that?
Mm-hmm. Yeah, thank you for the compliments, first of all. What I have been trained with, and again, Dr. Salahin Tom has helped me with this, is a process of going into, I think I've coined a little bit of a TQ, or a therapeutic quiet. So the more we can just be present and kind of try to quiet down all of the busyness of our minds, where we've been, where we're going, I try to help people to really get quiet first, to try to quiet their thoughts and their minds so that we then can be able to listen to the signals that are constantly being presented, and it's just a matter of being able to read that dialogue via signals by getting quiet and feeling that electromagnetically, the signals that are kind of presented from the body, as well as when you learn how to palpate, which is a means of holding on to a tissue to understand its state and the dynamics that are going on, that the more you can listen and wait to be shown and not go in, not kind of try to fix or try to provoke something. And that's kind of really what most of our training, I know that's what my training was in physical therapy, was you go in to provoke, to say, does this hurt when I pull or compress or twist or torque? And when
Which usually does.
Yeah. And when you do that, you're already reducing the ability for the body to tell you what already is happening, because the body will reflexively go into a very guarded, protected state. So you lose the opportunity, if you will, to really get a chance to get feedback. So a good example is going to a person's home for the first time. There is a process of knocking on the door, standing back, letting the person kind of see who's there, having them open the door. You're still waiting for them to, in a sense, invite you into their home. And then the dialogue of tuning in and trying to suss out what's going on is then a much more natural process versus me trying to say, this is what you're going to do and this is how your body's going to change. So that was a big shift for me to, talk about not going in and really waiting to be shown, because the body is constantly showing you all of their, in a sense, their story, their history from. So that for me has been a really exciting process, again, being the Sherlock Holmes, to kind of watch and see, and that you're constantly assessing and diagnosing from the minute you're holding on to the person to the time they're leaving you. Whereas a lot of the therapies are, we're going to do this therapy 5 sessions, and then we're going to do this for another 3 sessions, and then maybe after that reevaluate. Whereas I think you miss a whole lot of information, because every time you hold and listen, the body is constantly shifting and changing. So that's I think a big shift for me, going from that more provocative, more aggressive type of therapy to a honoring facilitator process. So.
And of course, the fact that I'm one of your patients, I can see this difference from what I guess I would call the external force to life force. Correct?
Yes.
And isn't life force one of the terms that you use?
I do. So part of the model that I learned from, again, Dr. Tom, was a human template model. And the model is based on a hierarchy of life forces, ranging from a material life force right up to the primary life force. So of the one, of God, of the noble process. So what I've seen as a context and a backdrop is that most people have a disorganized state of these life forces, from material, vegetative, animal, human, and then ideally we're all trying to achieve a kind of a noble life and dynamic of being inspired and seeing our path and seeing our direction. So often when people come in, those resources or servants are disorganized, or were consumed by those life forces versus them being a servant for us. So it really has helped me. For example, cranial fluid dynamics is one of the techniques that I utilize. It kind of lives, if you will, in the vegetative life force. So the autonomic nervous system, sympathetic and the parasympathetic nervous system, the part of us that nourishes and cleans and regulates blood sugars and things. That's often, when we're working from a cranial standpoint, we're helping people to feel and to sense themselves, so that paradigm we use, or the phrase we use, is out of right feelings arises right action. But it gives us more of a context so that I can also help people kind of say, hey, this strain pattern can not only be coming from an injury that you might have occurred from a car accident, for example, but it could also be a lot of emotional duress and stress that you might be having due to a loved one being very ill, or a spouse losing a job, and the pressures and demands of life. All of these actually are life forces that then can have a direct impact and cause an external display, such as a muscle tightness or a joint restriction, or nerve tension, such as a sciatic nerve being kind of wound up. So there's a myriad of things that can cause. So when people say, well, tell me why am I having sciatica? It's not as simple as saying it's this or that. It's so often we have to start to look at the ontological process to try to suss out what's going on. So.
And don't let these terms and these words confuse you in any way, okay? And it kind of sounds like, okay, what I'm hearing from you is, I come in with a problem, you don't just take an x-ray and then fix it, right? No. Everything that happens to us, and I've had this experience in my life too. You know how you've gone into a doctor and you think something's wrong, and you talk to the doctor and they do the test and they can't find a freaking thing. And they say, well, you must be under a lot of stress. What he's talking about is that everything in your life spiritual, emotional, physical, affects how you feel and how your body's going to react. This is what I've been learning from this very knowledgeable young man. And of course, everybody's young nowadays. So, but I have learned so much from people like yourself and the other people in our circle that it's not just going in and saying, this is wrong, fix it. And so when someone comes into you, you don't start right away. You ask them questions and get to know them, like knocking on the door and being invited into the house, because the house has everything from air and atmosphere to the colors to the furniture. There's a lot of different dynamics that all come together for that house. It's the same thing with our bodies, correct?
Correct. And I use the analogy often, Marilyn, of our bodies like a house. So you have a basement and a foundation, which is our we call the material life force, the record keeper, to be able to pull out our resources, our DNA, things that we've got gained from mom and dad, our culture, the first floor being the living space and our kitchen and the bathroom. So it's all of that autonomic nervous system, the vegetative life force. The next floor being the bedrooms is the servers, the animal life force, or the mammalian brain that helps us to do and engage its power and strength. And then we have on the next floor a manager, which is the human part of us that makes choices and oversees what the animal life force and vegetative and the record keeper are doing. And then ideally we have the owner of the house, which is the nobility of us. It's the part of us that's inspired to do things that are for the society and community and others, so that we then can ideally live a life that is surrendered to this great life force. So that kind of is that kind of hierarchy. And again, using the analogy is a really wonderful way for people to go, okay, I can see that, I can understand that. And sometimes as an exercise, a person has to go into their basement and see how it potentially might be cluttered or how
dirty.
it's scary to go down into, and that they start to see that they're not utilizing that resource, or that resource is cluttered, or that's maybe the reason why they don't feel like they're grounded and they have good footing, and that can help them to cause low back problems, for example. So it's been a kind of a neat process to go, you're more than just a mechanical individual doing physical therapy to move one thing into another position and to say hopefully it stays, but to really dialogue with them, which again, one of the definitions of a true dialogue is when the teacher is taught and the taught facilitates. So there's really a real wonderful exchange between two people, so we kind of quickly lose our caps of saying, I'm the therapist, you're the patient, I know what you need to be submissive and listen to me. That really, for me, was very heavy and was a sense of you need to fix me and need to do it in 3 sessions because my insurance company is only going to pay for that.
Exactly.
So work now. So
yes,
so it's been
that's another subject. Now I noticed that when we are together and we're working on this body of mine, we do talk.
Right.
Not only do we talk verbally, but our bodies talk. You receive, and my body talks to you. We start out with, I put my arm up and make it stiff, like this, and then he talks to my body and my arm reacts. Now you think, oh, sure, that's not going to work. I have tried to keep my arm stiff. I have tried to move my arm has a mind of its own. It doesn't follow what I think, it follows what my body says. And then he's explaining to me where you are checking, and he's saying, all these things that of course they're medical terms, and I don't know what he's talking about, except where he's pointing maybe. And then you say, aha.
Right.
And guess what? He goes and he treats that part, and it's like gone.
Right.
And my body told you.
And often it's the place where a person will go, that's the spot that I wanted to, because sometimes people will test me and they'll say, I'm not going to tell you where my pain is. And I want you to use, so Marilyn is talking about this process called ontological kinesiology, which we use a process called kinesiology or muscle testing. We would bring an arm up. Usually one of the shoulder muscles is a accessible muscle group, but we can use any muscle group in the body. And it's a binary system where when we contract a muscle, for example, say it's strong, I then can touch, locate, say Marilyn's coming in with neck problems, and touch her C7 cervical vertebra. If there's a charge there, it's out of position, when I hold on to the structure, there'll be an increased neurological activity that will then cause a switch where the nerve and the muscle meets. So the muscle that was strong will then temporarily go weak. So that's a feedback tool, another dialogue process that helps me to go, aha, we need to sequentially look at C7, and because I have two hands, I then look for another handhold. So that when I find the two handholds, what I'm doing is trying to see the shape of the strain pattern and the nature of it. Does it feel heavy? Does it feel rigid? Does it feel old? You know, there's different certain rhythms that I can pick up that also coincide with the life forces. So for example, just one of the rhythms is the material life force is this vibratory rhythm. So, you know, you'll feel this little signature oscillation, and that tells me, there's something about the material life force, i.e. something that she or the patient has received from their mom or their dad, or there was an old cultural model. So it helps to expand them to, again, us to have a better understanding of why is this structure, Ron, tight and stuck. In the old days, I would say, well, it must be just your posture, and well, it must be just the way you do your work things. And that can have some bearing, but often what I have found through my experiences, there's more. So yes, posture can be a way. If you're in a poor posture, you know, dental hygienists, for example, sometimes are in funky positions, and we work on that, but also there's a lot of times an underlying pattern that we also have to work with. So that's kind of that pulling on an arm and
which is kind of cool.
And working with. What I found, it's been incredibly specific, because I can hold on to C7. It says nope. I hold on to C7, disc space between T1, and that's the spot. So sometimes people are very, very specific, and if I'm just off a little bit, I won't be able to get that change. So the more specific you are, I found, the more effective you are to help the body shift and change and see the dynamics that are going on.
And then what he does is for instance, I have a lot of problems in my neck and my shoulder. And originally I thought, I don't want to go to a doctor or anything, because a lot of people my age end up with rotator cuff surgery, and that's probably what it is, and I don't want to hear about it. So instead what I did was I finally gave in and went to my friend here, and I don't need surgery. It wasn't that kind of a problem. But what you do then is, once the kinesiology, the muscle testing tells you what the problem is, then he goes directly to that spot and works on it. And you can actually feel it stretching and easing, and you can feel it too. That's the cool thing. You can feel it, not just me.
The signature response that I feel, and when I teach people how to palpate, is that the tissues, once they release, will actually expand, and the normal rhythm, we call it a cranial rhythmic impulse, will then start to resume, because all of these different stressors will superimpose on this natural innate rhythm, kind of like a sine curve that occurs about every 6 to 10 times per minute, that will then resume. So you'll feel this expansion of the tissues, and then a narrowing, and then it will start to resume. I'll follow it through a number of cycles. That tells me, we've released the tissue. We might need to come back to it later or another session, but that's kind of a signature response that tells me we've released as much as we can, and then we go through the process again of the kinesiology to say, where do we need to go next?
And it's very cool. Right now, we need to take a little break, and then we'll come back and talk some more. And I know it sounds a little confusing because of all the terms that he throws out there, but trust me, it means something very important, and it really works. So we're going to take a little break, and we'll be right back.
Can you help me with this? My new dad teaches me all
Cool.
kinds of stuff.
Can I
Wonderful.
borrow-
Sure.
He helps me with homework.
That would be 3.6795.
Thanks.
Yep.
He helps me with my decision making.
I wouldn't use this one. Ever.
And he's even teaching me how to drive.
And that's why cars have bumpers.
I'm learning so much.
You don't have to be perfect to be a perfect parent. Thousands of kids in foster care will take you just as you are. When some people struggle with their mortgage payments, they become frozen, petrified. Not knowing what to do, they do nothing. But the people who take action are far more likely to get the most positive outcome. Making home affordable is a free government program. Call now to talk one-on-one with a housing expert about the options that are right for you. Real help, real answers, right now.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Up, college is hard. Down, those books are heavy.
My sport is football, but my passion is education. So every year I take promising high schoolers on a college tour to show them that higher education means a brighter future. My name is Nnamdi Asamoah. I don't just wear the shirt, I live it.
You can be a reader, tutor, or mentor too. Take the pledge at liveunited.org/volunteer.
Do you wear this?
Bigger. Yeah.
Fantastic. Hi, we're back. We're talking here. We're here with Ron Agostini, physical therapist, plus from PT of Mystic here in Connecticut. And how many years experience? 25?
26, I think,
26
yeah.
now. I got a question. We've been talking about the different, you talked about the house and the different parts of the house. You mentioned vegetative state. Now, when we hear vegetative state, we think of someone who's in a coma or something like that.
Done too much, maybe illicit drugs that put
yeah,
them in a...
So can you explain
Yeah,
what you mean by that term in
yeah.
this case?
It is kind of you kind of say vegetal state, vegetative state, but yeah, so the vegetative life force is basically the part of us, the resource within us, the life force within us that helps us to feel, helps us to sense, helps us to shift and change. But it's also anatomically and physiologically the part of us that cleans and rids. It's the part of us that keeps blood sugars regulated. It keeps our blood pressures normal. It basically is the housekeeper within our body. So we use the term autonomic nervous system, which is parasympathetics, which is the nourish, repair, sleep-wake cycles, and sympathetics. So a lot of times you hear that in the literature and people reading about our sympathetics are heightened. So there's often an imbalance between the parasympathetics and sympathetics, which is fight, flight, guard, protect. So a lot of times what we're trying to do in therapies is to help balance a person to be able to have that normality. So for example, fibromyalgia, people that have a lot of lymphedema or lymphostasis, which is a stagnant, often they're in their vegetative life force and bogged down in it. People that come in going, Ron, this is kind of where I'm at. I've been having this pain in my back forever. And it seems like when you're talking to them that it's like you've been with them for an hour and it just doesn't seem like that is actually a little piece of saying they're in their field, they're in their veggie, they're in their feelings. Their feelings have almost started to consume them. So there is this boggy, stagnant, I'm having a tough time changing. I'm having a tough time getting out of. So fibromyalgia, to a certain degree, some of the people do kind of fall into this inability to, again, what cranial fluid dynamics, the technique that we use, helps them to do is to come out of these feelings so they can act, they can engage, they can change, they can move into their animal nature. So I see a lot of people that come to therapy are really stuck in their feeling state, or their autonomic nervous system is very imbalanced. So that's that kind of, but it's a really necessary resource, because we want people to feel. A lot of times people go, I don't want to feel. Just medicate me. Just do something to fix me so I don't feel that pain. So yes, we don't want people to feel the pain, but sometimes you have to go into the process, and that's where sometimes people have a tough time with, is you have to go into it to be able to come out of it. So we call it an indirect kind of process, whereas most, say for example, a chiropractic adjustment would be much more of a direct technique, much more of a more slightly provocative technique to shift and change. So I'm just kind of a bit of the opposite. So people sometimes go, yeah, I'm not sure I really want to, because I felt like I was a little bit manhandled by other therapies, and I was a little bit nervous. But a lot of times they'll leave going, wow, this really was a process that was honoring, and you allowed my body to kind of shift and change, and we went into it. And sometimes I have to hold on to a body part for 5 minutes before it actually shifts and changes. And that's the challenge in our medical world, is that, you know, a lot of times PTs have 5 or 10 minutes to work with someone, and then they have to go off to someone else. So that's where I felt like I've tried to stay true and work with the patient for sometimes a half hour to 45 minutes, and it's a very individual process to really help them to see their state and to really kind of understand, because a lot of times we try to avoid, or we try to, because that's a very normal, reactive, instinctive, protective mechanism to go, pain, let me go in the opposite direction, or pain, let me bury and stuff, but eventually it does start to get very heavy and boggy, and you see people with a gait that's heavy, and they are heavy-footed, and their shoulders start to slump. So a posture is a wonderful way to say, their animal nature is carrying often a burden. They're having to work 2 or 3 jobs. Their husband or wife has been laid up with an illness. An ailment. That's what I wanted to say.
Yes.
So it's an opportunity for them to see that those life dynamics will cause these postural dynamics, these pains and aches. Whereas people go, okay, you know, are you telling me, Ron, that a thought or a feeling is really the problem, and I don't have a real problem, but I'm telling you this muscle is really aching? And I'll say, no. The underlying thought, which might be obsessive, is a force that's like me hitting you with a baseball bat over that thigh. It can really impact that muscle to cause it to be tight or guarded or wound up or heavy. It feels like it weighs 500 pounds and I'm dragging this thing along. So,
and sometimes these things are from an external place. For instance, a family dynamic.
Right.
Can you give us a case of someone that you helped that came to you with a specific problem, and you were able to dig under and help?
Sure. Yeah, and this, interesting enough, this was earlier on when I started first doing this work, and it was a really, first of all, a difficult shift and change, because I came from, again, a very mechanical model, very aggressive manipulation, deep friction massage techniques, where I think it helped me to keep furthering my search for something that really fit me, because a lot of people would come back with those techniques going, you killed me, Ron, nice guy, you know, but wow, you know, I was hurting for days afterwards. So it helped me to keep searching for other methods. But I was working in a facility, a sports medicine facility, and I had the opportunity to work with a woman that was about 50 years of age, and there was 2 or 3 other therapists that were trying to work on her shoulder blade, on her scapula, and digging and prodding and manipulating, and the symptoms would change at best very temporarily, and they'd come back. So I kind of said to her, hey, would you be willing to try this new stuff that I'm doing, pulling on an arm, and also there's a part of the work where we use hand mudras or hand modes. It's kind of a sign language, another form of dialogue. So through that process, what we found out was that she was carrying a family pattern that was a burden, and often these family patterns or burdens are displayed in our body, in our shoulder blades. So the shoulder blades will be heavy, the muscles will be tight around them, they won't glide properly. So all of the physical attributes are there, but the underlying pattern was a family burden that what it was she found out that there was a lump on her breast. She was still waiting to see on a biopsy if it was cancerous or not, and what it provoked was that her mother had breast cancer when she turned 50, her older sister had breast cancer when she was 50, so she was incredibly fearful. But when we saw this pattern, this dynamic, and she was able to see it in different contexts and see that she doesn't need to be controlled by, or that this doesn't need to be bigger than the great life, that she was actually able to clear it. And I have to say, I was a bit skeptical. I was definitely going, but she came back the next day after that session and said, I feel great, Ron. I feel lighter. I was able to see the dynamic that you helped me to suss through, and to see that I don't have to follow this pattern, that I can be bigger. And that's kind of, there's a lot of research that's showing that these family patterns are not in a sense, a death sentence. That my father had heart disease and his father had heart disease, so it's just a curse, and it's going to be just that if you do start to see the dynamics and the patterns underlying that you then can actually change that. So again, I was very skeptical, but all of these little things have helped reinforce me continuing with this work, even though it is a little bit non-traditional, and there's times when it would be easier to follow that traditional path. But I know that I don't think I would be in physical therapy to this day if I was doing the traditional therapy. And again, it has its place, nothing against. It just found that this was the right path for me. So.
Now, we're not saying here that, when your doctor says it's all in your head, we're not talking about that. What we're talking about is underlying reasons that your body holds, and it shows through some kind of pain somewhere. And it's not that you are consciously or even subconsciously batting yourself on the head or in the shoulder. What it means is that sometimes we don't realize the pressures that we are under. We don't think about them, we don't understand them. And then we meet someone like this who can then come and help us figure all of this out, and all of a sudden you don't hurt anymore. That's kind of magical, don't you think?
And I thought the same. I remember being trained by a person that did cranial sacral therapy, which is a little variation, just another school of thought, but coming from the same research, that I saw this fellow doing this light contact, and he was very quiet and wasn't saying too much, and people would start to shift and change, and I thought he was a little strange and bizarre. But what I then started to realize, what he was doing was actually picking up these subtle rhythms that are present, and it's just a matter of training yourself to palpate, and it's practice, and it's needing to be in an environment that you can have time to help shift and change, and trusting, even though you know that the patient, and I always tell people after the first visit, and maybe you kind of felt the same way, Marilyn, is that I know this seems to be like I'm not doing anything. However, when I was holding onto this, say C7 vertebra, it felt like it weighed 500 pounds, and I was following, and it felt like I was reeling in a marlin, and then finally it shifted, and it released, and it made a big change. And when a person goes through a change of state, often there'll be a stirring process. And I know that when I say that to them, that you might feel it later. That's usually when it happens. I know they look at me like I have two heads, and they go, so it was challenging to, as a therapist learning these techniques, to go, okay, I know that they think I'm really out there and crazy, but they'll come back and say, you know what, Ron, I definitely was sore. It felt like I had an internal workout and I was beat up, but a good sore. It felt like that's what I needed, and the next day I was able to put my arm into my jacket when I couldn't for months, and that I felt like I didn't have that same morning pain to wake up. So So to me, that reinforcement of people, and again, people like yourself, Marilyn, trusting and believing and sharing to others has really helped me to allow that there is lots of different ways to help a person shift and change, but more importantly, for them to become their own physical therapist, if you will, so that they can be their own owner of their own house, so they can go, I know what I need to do, versus enabling, and that's what I did a lot unintentionally. I would say, I can fix you, and people would go, So getting back to the magical, the magical, I tell people, I feel honored, and I'm glad that you've shifted and changed, but magical sometimes too has that now you see it, now you don't, that there's that manipulation of, I'm pulling a rabbit out of a hat, whereas I say, the body really is doing a wonderful, this process is shifting and changing, so it's just a much more subtle process versus the traditional manipulation, deep friction, deep Swedish massage technique, but it's just on a much lighter level, but often when you are lighter, you can go deeper because the person invites you into their process. And so the neural systems often are bound and tight and stuck, and the more you allow that process to unfold, then you actually go deeper. You go deeper into the body tissues. So
the interesting thing here is that I have experienced all of this with him, and I have to say that it is an experience when you're not used to it and you don't know quite what to expect, because our history before that had been the traditional physical therapy. And now what we're talking about is we're talking about physical therapy that is also spiritual, emotional, baggage, everything, not just that affects your physical being. The first time I saw you and you were doing, you were getting to know my problem. I had pain in my shoulder and pain in my neck. Now, I'm at my computer a lot, and so that's not surprising. And I do tend to push myself and not listen. So I am guilty of that. But the interesting thing is that when he finished, I had to get up slowly from the table because, well, first of all, when you were done, we put the heat on my body, which is, it felt so good. But after that, before I got off the table, I felt very kind of lightheaded, and I was going, whoa. And then, I kind of controlled that and got over that. By the next day, I felt refreshed, which is really kind of interesting. And this happens each time because, what can I say, my bones are a little older and I'm still pushing myself like I was 20 years old. And so I do have need of this man to help me with this body. And it just, he knows, well, my body tells you, you listen, and you fix.
Right. Facilitate. Encourage.
And now you talk about we can then learn how to manage our own bodies. What do you mean by that as far as?
Yeah. So when you first at least have an understanding of, not only is my neck involved, but also my back is involved and my shoulders involved, the more they have an understanding of all of the pieces of the puzzle, then automatically they can start to manage better, to go, when my neck is hurting, Ron also had to work on my back and my hip, so let me also address, or let me be aware of either an exercise or a therapeutic quiet, an opportunity to say, let me just take a moment in a comfortable position just to check in. And I often tell people to try to dovetail it into their busy lives, such as when you go to the bathroom, take a moment to take 5 breaths and listen and just be attentive. Before you start your car, just to take a moment to digest maybe the day. So you can kind of do that more regularly, and the more you do that, you'll be surprised at how much you can feel. because people will come into me often and say, hey Ron, I'm feeling pretty good, and I'll say, hey, okay, great, that's good, and then we'll start to go through the process of seeing what we have to work with, and I'll hold on to something and I'll go, yep, I can feel that restriction. They'll go, Ron, that is sore, that is tender, and I thought I was really doing good. So there is not necessarily a correlation directly of going, hey, just because you don't feel something doesn't mean that there still isn't a strain pattern in the body. So sometimes it's really good to do your exercises, not only, and this exercise we try to be as specific to see the demands of what your tissues are doing and where the strain patterns are. I then specifically tailor an exercise program that hopefully will support and assist those strain patterns, because when you do the exercises, even though you might be feeling great, it's a diagnostic process too, to go, oh, when I started to do the shoulder rolls, I was aware that I was a little bit sore, but I wasn't feeling that soreness until I started doing the shoulder roll. So it becomes a nice a diagnostic process to go, yep, there is still some tightness, whereas most of the time we ignore until it really gets to a very a large scale where all of a sudden we're in trouble. So again, that idea of nipping things in the bud, of knowing what exercises to do versus what I used to do is rip off a sheet of exercises, 20, 30, and people would go, I need to do all of these, it takes me an hour to do these exercises, Ron. I don't have time in my day. And I found that the compliance was not great. Plus, I think there are too many. It's just going through the exercise to then get to the next one versus to do an exercise and sense and to feel and to see how your body is responding to it. And a person might come in and say, hey, Ron, you know what? This exercise doesn't feel right. So what we'll do is go, that's great. Don't keep doing it. We might need to modify or do something else instead. So that's the important thing,
And so we should not just depend upon this talented young man. We should take control. You need to take control of. I had to make some changes. I have problems with almost every joint in my body. See that? And so what I do now is every day I do these stretching exercises and these rotating, very mild, rotating exercises so that I am working every joint in my body. And I also check in, and what I do is, and maybe you would like to do this, I do the chocolate meditation. Now what that is you take a piece of chocolate. I love a chocolate kiss or a Dove. Oh, wonderful. And what you do is you pop it and you get very quiet, and you can sit, lay down, whatever you want to do. And it has to be quiet. I pop one in my mouth and I don't chew it. I let it melt, okay, and you get the real flavor. But beside that, what you do is that sends you into a different dimension, almost, chocolate heaven. And what I do is I just kind of check in with everything. And I say, okay, how are we doing? And then I just kind of do an inventory. And I relax.
And that's what we do every time we start. So it's a wonderful way for me, because every time I work with a person, I do it 18, 20 times a day, I have the opportunity to get quiet and to check in and to be submissive and surrendered to the great life as well.
So who helps you?
Yeah, when I can have my wife, who's also a physical therapist, assist. Actually, I've been have a little back problem right now. Hopefully, she's going to help me this evening. So, but yeah, a lot of times I'll get quiet. I'll do my exercises. So practice what I preach. And I also have some pals that do similar work that will get together and exchange and share. So I do my best to regularly exercise and to check in. And again, I have the luxury, like I said, to do that every day. So I get to go to work and check in and get quiet. Because I really do think when you do that, that then is really the basis to then go, my neck. Maybe these exercises. My neck, let me just be with it. And sometimes just by being with it and following it and going into where the strain is, it actually shifts and changes on its own. So you then can also do that. So there, it is that process. Some people have a little more of a challenge, but they can learn, and it is a process. I tell people it doesn't take 1 or 2 sessions. Sometimes it takes a while for things to keep shifting and changing. But when people can say, Ron, I remembered what you said, and I took that TQ, that therapeutic quiet. I took a moment to just check in. That to me is music to my ear. So that is when I know I've kind of been more of a facilitator and helped them become their own physical therapist.
And you know, I always wonder, like for instance, a dentist. So who do you go to? You know, it's like, how do you get help? What other things did you want to share with us that you, well, other than the fact that you also moved your office recently to a new space?
Yes, I have. Yeah, we're now in 943 North Road, or Route 117. It's it used to be where the Ledge Light Health District was located, and it's a house that was converted. So instead of it being a bit more of a medical type space, it's a very cozy, homey feeling. It's very quiet, and I look out into the woods from my treatment rooms, and so that's where we've moved in just recently, last couple weeks. Some of the other things that I do, along with again this human template model of taking it quiet, is visceral manipulation, myofascial release. I also do acupressure, so I do know a little bit about the meridians and the kind of traditional Chinese medicine. So I've had some training in that. Myofascial release is a release to kind of open up the fascial planes in the body that cover and sometimes lock down the muscles. And again, as we mentioned, some of the modalities. I sometimes wonder if people come to see me for my moist heat, because they just like to kind of hang out and stretch after we've worked. I always hope that I've done a little bit to kind of get them in that place that they're relaxed. But we also will do some of the traditional modalities to kind of help with increasing blood flow into the area, or if there's some inflammation, we also use a cold pack. But I do find that you have to know specifically what's going on to then have those other modalities be effective and helpful.
Now, you still do some of the traditional physical therapy. You have machines.
Yeah, we have a treadmill, and we have a recumbent bicycle, and we have a lot of balance equipment to help people along. So I do see a lot of people that have had total knee and hip replacements, and actually I'm working with a fellow that has a bilateral total shoulder replacements.
Oh, wow.
So, but the nice thing is I've learned that I don't need to crank and yank and tug and force people. Like Marilyn had a condition, it was a tibial plateau fracture, if you don't mind me asking.
Yes, it was.
And it's a very challenging diagnosis, because the range of motion gets really stiff, and it takes a while to loosen that up. And now I found, Marilyn, that I can follow the body and work with it and be a little bit more tuned in, so that instead of cranking, I can do it a little bit slower and see the different kind of speed bumps, if you will, so they still can get that range, but we don't necessarily have to yank and crank and tug. So it's been a great way to not have people leave me going, oh my God, Ron, you killed me. And that's been so. Yes, I do still work with people that have some of the post-surgical conditions. Meniscectomy, when I have a cartilage tear, for example, in the knee, is another condition that I work with. And even back surgeries. I'm working with a woman that just had cervical fusion and a disc replacement in her cervical spine, as well as lumbar fusions or lumbar disc replacements. So I do see a smattering of people with different diagnoses. So.
But the plus here is that, speaking of plus PT, or PT plus, is that not only can you help them go through the physical exercises that they need to do on your machinery or at home, they get the additional help from you the other ways, which can just be so much more effective, I would think.
I found that it really helps to enhance getting back that range of motion with a person with a total knee replacement, for example, and to get back there, I think, quicker and I think more comfortably. I had a person come and say, hey, I was aggressive and had a total knee replacement in her 50s, and she was in a place that they were really, again, that was a traditional model, and they're coming from a very good place that was really yanking and tugging and twisting, and she couldn't tolerate it, and she's a pretty tough person. And when we came, we started to use our kinesiology and our muscle testing, and not only did we have to work on the kneecap and the knee joint itself, we had to look at the hip and look at the lumbar spine, because often when a person needs a total knee replacement, for example, there's a lot of adaptation to the soft tissues for years and years. So people go, yeah, I was limping and compromised gait for 5, 6, 7 years.
Oh, wow.
So the total knee replacement is good and everything's in place, but all of those soft tissues still habitually are operating in that old place. So we do need to work on those, and sometimes work on them more so than what we actually think. Sometimes people just do, oh, we did our soft tissue, now it's time to just strengthen and really aggressively do the motion. So,
Well, Ron, this has been a pleasure.
oh, it's been a pleasure for me, Marilyn.
He's amazing. He's just amazing.
Thank you.
This again is Ron Agostini from PT of Mystic. And as they put the CG up for you so that you can get his contact information, I'm going to tell you we like to share the information. There you go. we like to, and it's a nice website, if I say so myself. Anyway, moving right
Thanks
along.
to Marilyn. Thanks to Marilyn.
Be sure to check our website, and we do have our shows up on YouTube. We have our own channel. If you've got an idea for a show, or if you want to send us information on an upcoming event, you can do it through the website or right there through our email address. And there is one upcoming event we still have time for, which is on Wednesday, July 9th from 6:30 to 10 o'clock. And that's a night of fun and support for Safe Futures, the pathway to a Safe Future Endowment Fund at the Connecticut Tigers Dodge Stadium. The tickets are $8, and this is a wonderful cause. This is a cause that was started a short period of time ago with Southeastern Connecticut Women's Network and Safe Futures, and you can contact them for more information. But their goal was to raise $50,000, and they've done that already, and they're now on the other side of $50,000, adding more, and it's a wonderful, wonderful thing. And actually, I'm going to have in a couple of weeks, actually 4 weeks, I'm going to have the people that were involved in putting together that program. We're going to be talking more about it then. This has been a wonderful show. Thank you, Ron, so much.
Thank you, Marilyn.
And thank you for joining us. And thanks to our crew back there, Frank and Frank. And please come and join us next time. Until then, be safe. And thanks again.